Hey guys, it's Casey and I'm going to tell you about my occupation-based kit. I designed Delirium Defense for an 86-year-old woman who I was able to work with on my fieldwork rotation in the acute care setting. She was experiencing delirium episodes as a result of sepsis from a UTI. She had difficulty maintaining attention and difficulty with orientation to herself, place, and time. She is a retired jewelry setter. She lives with her husband and their 2 cats, and for leisure, she enjoys designing dolls. Her main goals in the acute care setting were to minimize her delirium episodes and improve her overall cognitive functioning in the areas of attention and orientation. By accomplishing this, she would be able to return to her leisure activities. My Pico question studied the effects of cognitively stimulating activities and orientation methods on the number and duration of delirium episodes. After reviewing the available literature, studies showed that implementing these methods as a treatment for patients with or at risk of delirium significantly reduced both the number and duration of delirium episodes. Many studies suggested that these non-pharmacological treatments were often more successful than medication-based treatments in these patients. When discussing this project with my educator, she expressed to me that most delirium patients in the hospital receive non-meaningful word searches as a form of treatment because it's what's available. So I designed this kit because I was able to implement my client's interests into activities that would also stimulate her mind and require her to focus. By implementing activities relative to her life, I was able to orient her to herself and time as well. So for my kit, I designed 4 client-based activities, and the first one is bead stringing. I felt that this would be appropriate for the client because it relates to her old career as a jewelry designer, and it also allows her to be creative, which is what she does in her off time. So this activity requires the client to focus on both the pattern they're creating and the movements that it requires to do the task itself. The therapist can give them a pattern to follow, or they can have free rein to create their own. The second activity is a maze, which is very common for cognitive stimulation. The background is a dollhouse, which relates to her leisure activity of doll designing. And the pen acts as the doll, and she will take the doll from the kitchen through the maze all the way to the living room. The third activity I created is this block puzzle. It is designed with images relevant to the client's interests. For example, this side of the puzzle displays an image of 2 cats, which remind her of her 2 pets at home. When completing the puzzle, she has to focus on matching the colors of the pieces to create the correct image, as they do not have distinctive sides. It can be made more challenging by showing the other sides of some of the pieces of the puzzle. The final item in my kit is this orientation board that can be clipped to the patient's bedside. It is filled out by the nurse or any visitors that day and indicates date, their nurse from that day, any visitors they had, and a big event this week. The big event can be a current event or something they accomplished in their recovery process, and it stimulates conversation and orients them to time and place. This kit integrates best practice because it provides the client with meaningful activities that are relevant to her life outside of the hospital. Studies indicate that reminding clients with delirium of memories and meaningful objects can improve their overall outcomes and speed up the recovery process. Thanks for watching, guys. Hope you enjoyed.